Is a transconjunctival blepharoplasty right for my genetic under eye bags? I'm only 28, but all my life I have hated my hereditary under eye bags. Thanks, Dad. I think I am ready to take action, but I am extremely nervous. One of the doctors I consulted with spoke against simply repositioning the fat because it doesn't tend to stay where you put it. Not sure of the truth of this. My main concern is that he will not be conservative enough and too much fat will be removed, eventually giving me a hollow look, either soon after the surgery or as I age.
Thank you for your question. You're 28 years old. You've had puffy under eye bags that you give your dad credit for, and you've had a consultation with a doctor, and you state that this doctor phrased to you that fat repositioning tends not to stay where you want it to, or essentially the predictability is a question mark. And you're questioning whether or not to trust that opinion, and your underlying fear is that you will look too hollow. And so now you've presented this question to us. Well, to give you a little bit of background about myself, I'm a board-certified cosmetic surgeon, certified by the American Board of Cosmetic Surgery. My background is also in oculofacial plastic surgery. I'm fellowship trained through the American Society of Ophthalmic, Plastic, and Reconstructive Surgery, also oculofacial plastic surgery, which means my background training before cosmetic surgery was in eye surgery, and then I'm a specialist in cosmetic reconstructive surgery of the eyes. And I've been in practice in Manhattan and Long Island for over 20 years. So to begin with, it's clear that you understand you do have under eye bags, and that the under eye bags are caused by fat prolapse. Now this fat prolapse, the question is what to do about it. And certainly you have this opinion about transposition which you're questioning. Now, to understand what you're afraid of, or so-called hollowing, you have to understand what the definition of hollowing is. Many people feel that their eyes look hollow after eyelid surgery, but very often the concern is really because the eyelids are retracted. In other words, the lower eyelid being pulled downward causes a more of a hollow look overall than the absence of fat under the eyes. The other factor to understand is that there's a relationship between the eyelid area, or the orbit, the space around the eyes, and the cheek area. And if someone has a very flat appearance, sometimes they may interpret that once the bags were gone, they looked, quote, hollow. So when I look at a patient, I always look at these relationships and I discuss with them what they can expect after surgery. Very often the tear trough area may be relatively hollow, or the eyelid cheek junction can be relatively hollow, and the malar and submalar area can be relatively hollow. And all of this goes under the umbrella of hollowness. Now, to address the question about transposition, this is something that I think that, your question, you being 28 years old and you're doing your research, and unfortunately, you're feeling like you can't necessarily trust the doctor. And that's not a good thing. You should feel comfortable with your doctor, and I'm not sure why you would not trust your doctor's opinion. Anyone who has trained in a surgery specialty which performs cosmetic surgery and has a lot of experience with eyes certainly draws from their experience to give you an opinion. And when the doctor says that the transposition may not stay where you want it to, certainly I would say that this doctor is correct. For several years, the idea of moving fat from the orbit into a space below the orbit has come and gone in different waves. And there is going to always be doctors who disagree in what they do, but there's also a lot of difference in how they do what they do. So My own experience with fat transposition is it does have a place, but it has a very limited indication. And as a specialist, I see a lot of patients who have had procedures like this who come in 2 years later saying, I'm still puffy. And a lot of times it's because the transposed fat didn't stay where it was intended. Part of it may have disappeared, and the rest of it ended up back into the eye socket. And so when you think about hollowing, think about it this way. In my consultations, I tell our patients that the puffiness under the eyes is a hernia, and the fat moving forward creates that herniated look. Now, imagine what your eyes would look like if you didn't have the fat there. Now, that helps give you a different sense of visualization. That means that the eyelid would follow the natural shape of the eye and go along and follow the shape of the rim. Now, if there's volume loss along the rim or below the rim, then that can be addressed in a variety of ways. So, I think that you should meet with other doctors to get more confident about which doctor you feel comfortable with, and understand that there are more than a few ways. But just to give you my suggestion, if based on your photos alone, I would perform a transconjunctival, which means from the inside of the eyelid, lower eyelid blepharoplasty. Very often we combine this treatment with platelet-rich plasma. Even though you're relatively young, it does help with skin quality, and it does help with some volume improvement in the eyelid to cheek junction. But that combination has been very successful for us. 20 years of practice and doing this type of approach, whether it's resection, transposition, or any other variations, there's an art to doing this. It is sculpting, and it's judgment. So an artistic eye, a sense of proportion, how much to take, how much to leave behind, these are also important factors. So you should feel comfortable and confident. There's a certain intuitive perception that if you take the fat and you move it somewhere, that it'll make it look better and is, quote, more natural. But there is a flaw in all of this, this logic, and it depends very much on the individual patient and other factors such as skin thickness, skin quality, and the risks and benefits. You have to think of all of these things and have these factors articulated clearly so you can make an informed decision. So I hope that was helpful. I wish you the best of luck. And thank you for your question.